This presentation is about the recognition and prevention of urinary tract infections and provides advice for care homes. Residents who do not have a urinary catheter but have a UTI will typically have a temperature of greater than 37.9 degrees Celsius and will have 2 or more of the following symptoms: burning or pain on passing urine, new or increased frequency of passing urine, new or increased incontinence, or new or increased urgency in passing urine. So if this is the case, it is vitally important that you seek the advice of a GP or a practice nurse and obtain a urine sample for laboratory testing. If a resident has a urinary catheter and a temperature and also displays any of the following symptoms, again you must seek the advice of a GP or a practice nurse. Those symptoms include new or increased confusion, visible blood in the urine, flank or suprapubic pain, and shaking or chills, also known as rigors. The information on this slide details how to obtain a sample of urine from a catheter and are based on the Royal Marsden guidelines. So what happens after a urine sample is taken? The sample is sent to the laboratory in the hospital and is tested for bacteria. If any bacteria are found, the lab staff then determine which antibiotics are needed to treat the infection. If a GP has started treatment, this test will determine if the correct antibiotics have been prescribed. If not, the GP should change the prescription as they may not be effective. If antibiotics have been started but no infection has been found, the treatment should be discontinued. This will help prevent resistance to different antibiotics. Historically, there has been an over-reliance on the use of dipsticks or urinalysis sticks to determine if a patient has a urinary tract infection. Dipstick testing alone should never be used to diagnose a UTI, as the results are unreliable, and it can lead to the over-prescribing of antibiotics, which can lead to further infections such as Clostridium difficile. Therefore, the National Institute for Clinical Excellence recommends that 2 consecutive urine samples should be taken to confirm if a patient has a UTI, and that antibiotic therapy should not be used to treat any patients who do not have symptoms of a urinary tract infection. If a resident has a urinary catheter, the need for that catheter must be regularly reviewed. HOUDINI is an acronym that outlines justifiable reasons for a catheter to remain in place. If a catheter has been used for any other reason, it must be reviewed and a decision must be taken as to whether or not it could be removed. There are some simple measures that can be taken to prevent urinary tract infections: hand hygiene, the use of personal protective equipment, toileting and personal hygiene practices for the residents, and catheter care of both residents and staff. Always adhere to good hand hygiene practices and keep in mind the 5 moments for hand hygiene. Use appropriate PPE such as gloves and aprons, and make sure they are changed in between each task, even if they are performed on the same patient, and dispose of all used items correctly. These are the 5 moments for hand hygiene. Number 1 is before touching a patient. 2 is before you undertake a clean or aseptic procedure. Number 3 is after exposure to blood or bodily fluids. Number 4 is after touching a patient, and number 5 is after touching a patient's surroundings. Toileting and personal hygiene of residents is an important part of preventing UTIs. Residents who use the toilet independently should be encouraged to maintain good personal hygiene before and afterwards. Likewise, if staff are assisting in this activity, they too need to wear appropriate PPE and adhere to good hand hygiene. The correct use of incontinence pads is vital, such as making sure that pads are changed regularly, and it's also important to avoid constipation. It's really important that staff know how to care for their residents who are catheterised. Hand hygiene and personal protective equipment will help prevent the introduction of organisms into the catheter which can cause infections. It's also important to know that we should attach night bags to the leg bags to try and maintain that sealed system, and that we dispose of the urine in those night bags in an appropriate manner. Numerous studies have shown that keeping hydrated can help prevent UTIs. The Care Quality Commission look at hydration when they do their inspections of care homes. They expect that staff have a way of identifying when a person is at risk of dehydration, and that those who are identified as being at risk have their fluid intake monitored. This requires being regularly reviewed by staff and having a care plan which articulates just exactly what those risks are and how they are being managed. We all need a certain level of water in the body, and it helps maintain a constant body temperature. It helps with our circulation, our digestion, and our waste removal as well. There are lots of causes for dehydration: not drinking enough to replace the fluids that we naturally lose through sweat and respiration, but it could also be caused through somebody having vomiting and diarrhoea. So whatever the reason for dehydration, it's really important that we replace that water through drinking lots of fluids. We can identify if somebody's dehydrated by using the 5 senses. We can look at residents. Do they look like they are particularly dry? Is their skin flaky on their arms and legs? Are they behaving in a way that could suggest that they are dehydrated because they are drowsy? Are they not going to the toilet as often as you would expect them to? Or is that urine more yellow or orange than you would normally expect? Patients could complain of having a dry throat. They could have difficulty swallowing. And also, it's about listening to the patient. Are they suddenly complaining about feeling dizzy or confused? Sometimes it might be possible to detect a resident is dehydrated just by the smell of their breath. If they don't drink enough, they don't produce enough saliva, and that can cause food particles to collect in the mouth. We can also touch residents' skin to see if it feels dry, and we can also do the skin test. We use 2 fingers to gently pinch the skin on the back of the hand and then let it go. The skin should spring back to its normal position in less than a couple of seconds. If it takes longer, they may be dehydrated. Staying hydrated helps prevent infections and keeps antibiotics working. Adults need to drink at least 1.5 litres of fluid every day. This equates to about 8 large cups. The older you are, the greater risk you have of being dehydrated, and therefore our residents in care homes are particularly at risk. So things to consider to prevent dehydration. Offer drinks in cups or glasses which the residents can easily hold. Ask them what they prefer. Do they want a small cup or a large mug? They may even want a sports bottle or a glass with a drinking straw. It could also be useful to use a colour-coded cup to indicate residents that need more assistance with drinking. Offer their preferred drinks more often. Not everybody likes tea and coffee. It could be that they prefer fruit juices. Make sure that drinks are offered very frequently. Consider offering drinks overnight and before breakfast, and certainly whenever medications are being given. Patients may be reluctant to drink to avoid needing the toilet, but that is a vicious cycle, and that could lead to dehydration. So patients need to be encouraged to drink as often as we can. Most types of drinks provide fluid, except of course strong alcohol. Further information about hydration and urinary tract infections can be found on the following websites: